Fort Worth. Thank you for being with us this morning.
Thank you.
Okay, so let's start with the basics. What is a partial mastectomy?
Partial mastectomy, often called a lumpectomy, is removal of the breast cancer and then a rim of normal tissue around it.
Okay, and the key is to get a clean margin, is that what they call it?
Absolutely.
And the idea is to get all the infected tissue.
Yeah, all the cancer out.
So what is the concern then that once they have that procedure, they may have to go back in to have more taken out?
What I explain to my patients, because we don't know, is that some of the cells are microscopic. And so we try to remove all the cancer, we do all we can, but when the pathologist looks at the specimen, there's always that possibility that we didn't get it all, and you may have to go back in. And I explain that to my patients before the surgery.
And so then you just wait for follow-up visits and wait to see if anything is growing?
No, you don't wait for follow-up visits. You get your final report from your pathologist, and the pathologist is able to tell you you have cancer right at the edge, you have good clean margins, or there's cancer all the way, you've cut through the cancer basically, and you need to go back in and take more tissue out.
Can they do a blood test to test for cancer cells in your body?
For breast cancer at this point, no.
Okay.
And so what we really rely on is that pathologist report. I mean, there's some that we can see, and if it's a palpable lump, when you take out the tumor, you can cut through it and take a look at it, and the pathologist takes a good look at it. But until he gets that specimen underneath the microscope, you don't know for sure.
So is it a while then before you can actually give a patient a clean bill of health?
Well, some of that is the nature of cancer. It's kind of two separate issues. When you talk about lumpectomy and removal of that cancer, and you talk about making sure you get it all out, you know that once you've completed the surgery, whether you go back, one more time, not at all, two more times, you know once the surgery is complete that from that standpoint the cancer's all out. The trouble part is, of course, did any cells escape into the rest of the body?
Right.
That's where chemo comes in, that's where radiation comes in if you're worried about the rest of the breast, and that's an important part of doing the lumpectomy.
Right.